Hi friends, it is Courtney Jackson here with Courtney Jackson RN Care Solutions, coming to y'all with another video. I'm talking about anemia. I did want to make sure that y'all still take a look at the other video that I made. I made a little quick clip, like a 16-second clip, but I really wanted to go in depth with talking about anemia. A lot of people have anemia and they don't even know that they have anemia, but they have all of these signs and symptoms, and not treating anemia is only going to hurt you in the end. So I wanted to talk about a few things with it. Some people don't even know what anemia is, but anemia is basically there being a reduction in red blood cells. And as y'all already know, or may know, not know, with the red blood cells, what's in it, it carries the oxygen throughout our body. So it is painful if you don't have the oxygen being able to be carried throughout your body. That's where you get that pain from. And so that's the cause of it, just that decrease or reduction in the production of the red blood cells. But like an example of it would be something like iron deficiency anemia. And that would be that you have an iron deficiency. So you don't have in the blood what needs to be carried to all of your organs. But that's the most common cause. There are so many more, but I'm just dealing with that one because it's more common, and more people have that one than the other ones. And you know, some people with like the B12 deficiency and this and that. There's so many more. So, but I just want to deal with like the most common one, which is iron deficiency anemia. And so certain symptoms that you'll have with anemia would be like you'll feel fatigued, you'll feel really tired, you'll feel having heart palpitations, you'll have chest pain with it as well, you'll feel short of breath, you'll feel dizzy, you'll feel like you want to pass out, you'll feel probably even with a headache as well. Definitely we'll see a headache. More things would be like having weak fingernails or hair, having weak hair, brittle hair, yellow skin, or just a change in the skin color. With the hands, they could be cold all the time, and you'll notice that with people that have anemia, their hands or feet will be super cold. Because you need that oxygen to go to different parts of the body. And if you don't have oxygen, then there's no nutrients that can get to that area. So if it's cut off and I can't get that to that area, it's going to be cold. There's no supply that'll be going there, and it's going to be very difficult, and it's going to be painful. And then other things, people sometimes have trouble with like sleeping, so they'll have some insomnia, and you'll notice a lot of people with anemia, they will be up a lot. And then some people have poor focus with it as well. They'll struggle. And that's why it's so important to catch it while kids are young. That's why they do the lead and CBC at early ages, like at 1 or 2, or just before they start daycare or school. They want to catch that early on, because if you have loss of focus with anemia, imagine how those kids are going to be in school. So it's so important, just for everyday life, to be able to know these signs and symptoms and be able to get help, especially kids. Because this is a critical time for them to learn, to grow, to, be able to advance and think. These kids, they turn into teens, and the teens turn into young adults, and the adults, this is shaping the rest of their lives. So, you don't want that, being ignored when you could, start treatment, ASAP. But, sometimes you can get leg cramps with, anemia as well. Like I said before, shortness of breath, things like that. Some foods. I wanted to talk about foods that you could take or consume, eat, to help you to prevent, like, I would say to prevent any pain, it from progressing and getting worse, things like that. I would say some foods would definitely be foods with iron in them for sure. Like whole grain breads or spinach, greenery, red meats for sure. And sometimes, like with vegetarians, sometimes they have some issues with having that because they may not eat that red meat. But knowing what other things could replace it could really help with the type of foods that you consume. Peanut butter, because of the protein in it. So really bulk up on that protein as well. Beets. Now beets, I don't eat beets, but beets are really good for a lot of diseases and all of this, because what we're trying to do is prevent things. So if we can eat the right foods or take the right supplements, I'm not saying you always have to eat to be able to get those things that are nutritious to us. But I'm saying make sure you get some source from any source to get that, like peanut butter or soybeans or tomatoes or oatmeal. But beets for sure, it's like number one on the list for a lot of things, especially for blood pressure, helping to lower blood pressure rapidly. But I did just want to talk about these few things. A lot of people just don't know what anemia is. They don't know where it came from. They don't know who has it. They don't know much about it. But I just want to make sure that I educate the community about simple things like, iron deficiency anemia, to where we can definitely help each other. And some say cooking in an iron skillet could definitely help. Knowing what time to take iron and what to also take with things with iron. Making sure for your vitamin C, it being able to help with absorption and all of those things, or making sure you take a stool softener because it may constipate you. So there are so many different things that, that I would like to share and help everyone. But y'all got to continue to follow my page to find out more. And if y'all have any personal questions or concerns, or if you want to know more about a content that I don't share on one of my videos, please reach out to me. Comment. Make sure you subscribe, of course. And it's not just so that I can get views, but it's to spread awareness, because I'm all about prevention, preventative measures for diseases, for disorders, or just simple things. So y'all let me know what y'all want to see next. And if you want to know more about anemia, the different types of anemias, more about the causes of it, y'all please let me know. So make sure y'all go ahead and follow the page, Courtney Jackson RN Care Solutions, where you can find out much more. Thank y'all so much. Bye.